Welcome back to The Blend. If your legs aren't the only thing that's kicking, chances are you're going to see our next guest. That chronic bad breath may be caused by a larger dental issue.
Dr. Joel Stokes of Eastern Canyon Dental is back to talk about, we're kind of laughing about it during the commercial break, but it's a real thing, bad breath.
Absolutely. You know, many times we come onto the show and we talk about cosmetic dentistry, how to look better, how to feel better about the way you look.
Of course.
But, and also that's the first opportunity you get a chance to meet somebody. But if you ever met somebody that you walk up and you're talking to them and you can't stand the way their breath is.
You have to bob and weave, yeah. Exactly.
Yeah, and you actually turn around, right? Anyway, bad breath is caused by a number of things. Number one, 80% of bad breath is caused by oral dental mouth problems.
Okay.
10% from sinus issues. Especially in this time of year when we get all the sinus, the dust and all that stuff. People have sinus infections. And also digestive system disorders. And for sinus problems, we send people to ENT, ear, nose, and throat. For digestive systems, gastroenterologist. But if 80% of the problems are from dental and oral, we can help take care of most of that. And at least we can intercept it and let people know what's going on.
Popping a mint is essentially like trying to paint over a wall that's falling apart. You need to figure out what's wrong with the wall.
That's true. You got, most of the problems stem from periodontal disease, gum disease.
Really?
And where we have the bacteria, their germs that are stuck underneath the gums. This is kind of like a demonstration model, kind of looks like this right here. But over a period of time, periodontal disease can work its way down the gums and the bone and cause tooth loss and some real issues. And we know, and it's demonstrated through research, that the bacteria in the mouth can not only be in the mouth and cause bad breath, but it can go into the entire system and cause, it can hurt your immune system.
Yeah, that's true.
It can compromise different organ systems in your body. We actually know that those bacteria have been found in heart tissue and in brain tissue. And they find that on autopsy, but that's a tough way to find out.
Of course.
But those bacteria go everywhere.
Wow.
And so the breath issue is because of the bacteria. And we bring people in. They can come into our office. It doesn't cost anything to find out what...
You know right away, don't you? I mean, you must be very tuned in to when there's decay that you can smell.
Yes, it's not only the gum and bone problems, but people have multiple teeth with decay in them. That's the same bacteria.
Yeah.
Aww.
And that bacteria causes odors, just like in your kitchen. You have bacteria that are in the kitchen on the sinks, causes odor. In the mouth, the same thing happens. So it's very standard in our office, where we actually, somebody comes in, they want to find out the status of their mouth and what's really going on, and we don't charge anything to find out. At least somebody should come in and get an appraisal, find out what's going on before it gets really bad.
What's the best way we can prevent these serious issues before they happen? Cleanings often? How often?
It depends on the status. Some people come in on a regular basis, 6 months. If people have advanced problems with their gums and bone, we go into more of an extensive treatment, and we bring them in every 3 months, 4 months, and if things get better and they get better and get better, then we can move it out to 6 months. But this is a serious thing. Periodontal and gum and bone disease is probably the most common disease known to man. Over 50% of all people have some form of gum and bone disease in their mouth.
Wow.
So come on in and let's find out and let's let you know what it is, what's going on.
Absolutely. We saw a picture just a moment ago of a blonde gal with fabulously white teeth. Of course, that's what we all long for.
Hi there.
It's there she is. But you know, if you're not quite looking like that, and all the way to you treat people with very, very serious issues. But I mean, you've helped people make progress.
Wow.
I mean, look at this. Is this one of your clients?
This is, and she's actually been on the show with us in the past.
Yes, I remember.
A while back, but
it's remarkable the turnaround that you're able to
it
make.
It is. It's phenomenal. The most important thing is, just like any other medical issue, is early detection. Come in, get everything checked, get some X-rays, get some measurements around the gums. We can actually forecast if things are going to happen. But that is probably the primary reason for bad breath.
About 30 seconds left. A lot of people, they don't end up going to the dentist until it's just like, oh my goodness, I got this pain. Why should they be going more regularly to avoid that?
Well, like I said, if we find things early, it's easier to treat.
And a lot less pain.
A lot less pain, lot less expense.
Which means they'll probably hate going to the dentist a lot less.
That's true.
Exactly.
The longer something goes on, the more fearful people get. They get embarrassed about the way their teeth. I've got people come and say, "Are you going to lecture me about the condition of my mouth?" I said, "No, I'm here to help you get better."
Yeah.
Okay.
Awesome.
So that's what we do. We're there to help.
Send them to us. We'll lecture them.
There we go.
Right?
Well, you do that
We'll
well.
slap hands. That's all we do. All this slap the hands. Ow. That's the 4th time she's done it in the show. It's
You
great
know
having
what?
you, doctor.
Stop counting.
That's
Thank
because
so
you have
much.
bad breath. Right.
He does not actually.
No, I'm just
I
kidding.
have to
I'm
say,
just kidding.
He does not.
I'm just kidding. I'm just kidding. Yeah. Anyway.
Eastern Canyon Dental. They're located on Southeastern, just south of Wigwam. Visit thevegasdentist.com or call the number on your screen for more information and get rid of that bad breath. Halitosis. It really is just the test to see if you have bad breath. Just say halitosis. You'll know. Eastern Canyon Dental, proud sponsor of the Morning Blind.
See, Dr. Stokes is getting a little sassy. That's what happens when people become regular guests on our show.
He's like that.
Yeah.